Ladies and gentlemen, thank you for coming. This is a very important panel, roundtable actually, even though it's not super round, but at least you can see us. So I'm glad and happy to introduce you, our lovely speakers, who agreed to come to this summit and talk about very important topic. Honestly, it was my idea originally to make a panel on this topic because I find it very important. It touches my heart very much when I see elderly people in Ukraine and how struggle they, because life in Ukraine is not easy for elderly people, unfortunately, and especially when the war came, it became even worse. So thank you, beautiful ladies, for joining us today to talk about these important things, and I believe we can figure out something very important and useful which can be implemented afterwards. So, we are having here Varvara Tertychna, the co-founder and CEO of a charitable foundation called Starenki. We have Iryna Shevchenko, who is the founder and director of the charitable organization Nezabudny, which helps people with dementia. And it's the only organization in Ukraine which is focused on that specific aspect. We have Khrystyna Semegen-Bodak, who represents international organization Caritas Ukraine in Ukraine. And she is the head of the healthcare unit at the Caritas Ukraine organization. We have Brittany Armstrong, our guest from the United States, and she assumed the role of the director of Ukraine Telehealth Initiative at Northwell Health Center for Global Health. So she's expert in telehealthing, let's call it so. She will explain what does it mean. So to help people, you can do it over tele nowadays, luckily. And we also have Valeriia Palii, who is the president of the National Psychological Association of Ukraine. And she has a PhD degree in clinical psychology, and her expertise will be very useful today for us. Thank you for coming. So, as I googled, correct me if I'm wrong, there are around 11 people of retirement age in Ukraine. It has always been hard for those people to live in Ukraine, to survive. Most of them live in a poverty, in like severe poverty, unfortunately. And when the war started, it became extremely difficult, because elderly people are one of the least protected segment of our population. And let's try to understand why and what can we do to help them to live better. So, what are the main problems of elderly people in Ukraine, and how did they increase during the war? Could you please all share your vision of this?
Okay, so let me start. The last year provided us with the possibility to study more, not only about Ukrainian elderly, but also about the international context. And I can say that actually not only Ukrainian elderly live in quite hard conditions, but elderly overall in the whole world face many issues which are constant and which need to be fixed. And one of the common one, and they are also actual and for Ukrainian elderly, and one of the major, as we think in our organization, is the social isolation, which is one of the most logical one, because when you are becoming not economically active, you automatically fall out of the focus of producers of goods of almost any kinds, I don't know, restaurants, cafes, also the service organizations, and also you fall out of the sphere of interest of the state, because state doesn't receive anything out of you, out of your activities. It only can provide you with some. And actually the social isolation is also like becoming stronger because of the ageism, because of the age-based biases, and this is also a common issue for the whole world, and Ukrainian elderly are also feeling it quite hard on themselves because our society is quite ageist. And other problems which also are quite obvious, and you have already mentioned, is for the lack of income to cover even the basic needs. Up to 45% of elderly in Ukraine lack money to buy sufficient food or basic medicine. This means that if to think about it, this is very, very sad statistics, that half of Ukrainian elderly are having not enough funds to buy sufficient food. As well, they don't have enough money to buy basic medicine, and according to the latest UN data, there are really around 4 million people of older age in Ukraine who need assistance, and this is really a lot. And also a very important issue is the health issue, and this is also for Ukraine quite a complex problem, which is caused by lack of prevention, and it is also a mix of like economical and cultural backgrounds, and this is a big issue because of the current state of health security system in Ukraine, and elderly people are not getting sufficient health support. And the last but not the least issue which we have outlined is the environmental and infrastructural one, because despite the fact that elderly people are almost 30% of the population in Ukraine, environment is not friendly for them, and it is not really moving towards being friendly for elderly people who can have some disabilities, or they need some other special things to feel comfortable in cities, and this is also not a thing which could be solved really easily, and will probably remain quite a big problem in upcoming future.
You mentioned medical issues. I would ask Khrystyna to fill it up. I'm sure you have what to add about especially this angle, right?
First of all, I want to thank you for the opportunity to participate in such a discussion, because the topic of elderlies is very important, and it was important all the time, but still after the 24th of February 2022, they are alone. They have a lack of opportunities for medical care, especially for ruined facilities, for medical facilities ruined, and they are afraid even to leave their homes. And there are a lot of elderlies in Ukraine with disabilities, with the relatives who left abroad, and they have no opportunity to receive even primary medical care. This issue, this problem, we in our organization in Caritas Ukraine, we thought about it and decided to find some opportunities to resolve this problem. And I want to tell you about when we were seeking for the resolution of this problem, we understood that not only basic care is necessary for our beneficiaries, for our elderly beneficiaries, but especially they have a great lack of medical care. And we started a pilot project on May 2023 of establishing primary medical centers which are located to our Caritas centers in 5 regions, at first. They are located at 5 regions of Ukraine. What does it mean? There we will have a mobile team who will visit our elderlies at home, and they can receive consultation of primary physicians, of family doctor, of trained nurse who will help to provide basic treatment. And when we are talking, I want to add to my colleague, when we are talking about elderlies, due to the latest data, we have in Ukraine nearly 18% of pensioners. Among them, the most are women who live under the line of poverty, and that's why they have no opportunity to buy even basic medicines. And I think that the only opportunity for them to receive some medicine is the NGOs which are working through our country, especially with the help of international partners.
And as I understand, we don't have enough NGOs like that, right?
Yes.
We have way too many elderly people and not enough NGOs to cover that. And you mentioned you're going to open 5 centers. Are they going to be in big cities or some little towns as well?
Yes, they are already established. We started only in May, but they are already established. Today I received the order from the Ministry of Health of Ukraine that all of them received a license. We have today very good news because we have already a team of family doctors, of nurses, of psychologists who will provide, and they are already providing consultations at beneficiaries' homes, because as you know, beneficiaries in our countries, old elderlies, most of them don't have smartphone, they cannot receive a telemedical, but we are thinking of this type of help, this type of activities. They have no opportunities to receive telemedical consultations. That's why at that center there are mobile teams who will get to the beneficiaries and help them. The team consists of a social worker, of a doctor, nurse, and a psychologist. And if somebody needs some type of help, we decided that this will help to our organization to provide a holistic care. Because before the war, during the war, our organization, with the help of our international partners, provide humanitarian aid, social aid, because we have a home care network for more than 20 years. We already have 23 Caritas-based centers of home care among the Ukraine. We have 6 shelters for IDPs, for elderly IDPs. We have 3 centers of social palliative care for beneficiaries with severe illnesses. And now we have 5 medical centers for primary medical care, and one of it already is spreading its, widening its license for the secondary medical care. And all of these facilities, all of the centers have an opportunity, have trained staff to provide standardized home care services to provide medical care and psychological care. That's why we are trying to provide their assistance to our beneficiaries, but still we have a lot of challenges due to alarms, due to the safety situations, especially in the eastern and the southern part of Ukraine. As you know, most of elderlies who need help, most of alone elderlies are located at the eastern and the southern part because they challenged with their relatives, their younger ones left because of safety situation, and they left alone without any help, even without non-formal caregivers.
They couldn't leave themselves. For lots of elderly people, it was very hard to do, right?
We even started such a new type of help, cash for care. The care which is providing not with the help of trained social workers, but with the neighbors or people who want or who have an opportunity to help. We are training them, we are showing them how to provide basic care for elderlies, and they receive, with the help of our donors, they received from the project some fees. It's nearly the minimum salary, and they can provide and help their neighbors. It's such named non-formal caregivers. It will help to develop society resilience and to make an emphasis on the problems of elderlies, because I think that only NGOs or state or government cannot provide this type of help for elders. We have to add and to involve our society to help and to emphasize on this problem. Thanks.
I agree. I think all of you agree that all society needs to grow that proper attitude of care. And I know that Iryna has a lot to add to that because she works with very special symptoms elderly people often have. So please share your experience.
Thank you. I also want to start with a thank you for bringing us together today, and I just realized that we never had a chance to meet like this in Ukraine. So this is the first time I think we have a similar panel, and we have a chance to really talk openly about our issues. So I work in the field of dementia, and just for those, maybe I suppose that there are people who do not know what is it. I can just very briefly just say a few words about it. So dementia is not one specific disease. It is a syndrome, a combination of different symptoms, like memory loss, or the person cannot do the everyday tasks, or wandering, and so on. But it is caused by different diseases, more than 100 diseases, and Alzheimer's disease is one of the major diseases. So this is not a normal part of aging. So that I just wanted to emphasize. So our target audience is 90% of people are 65 plus. So this is where we overlap. So, but there are 10% of people who can get dementia at any age. And about the problems that we have is actually this is such a big, complex situation and issue in Ukraine that I even have a hard time to start to figure out where to start. About the awareness, for example, why I decided to start with the definition of dementia is that really just the awareness of dementia is very, very low in Ukraine, unfortunately. People just do not know what is it, and they do not know the first symptoms. And knowing the symptoms, a person can go to the doctor, and if he goes, the sooner he goes, it is possible to make the progression slower. Or maybe it can be not a dementia. Another thing is that people do not know the risk factors of dementia, and there are 40% of all dementias can be minimized by 30%, the risk of dementia. So this is number one, a problem. So we, as a society, have to talk openly about dementia. There is a big stigma about dementia in our country. Unfortunately, everybody is afraid to talk about it. People feel shameful to talk that somebody has dementia in their family or that a person has dementia. So when the symptoms are already very heavily shown, then a person goes to the doctor, but then it's already too late to slow down the process. So we as a society have to build a dementia-friendly community, which is called all over the world. And this is a society where all the country knows what it is, understands the specifics of dementia, because this is really a very hard symptom for people, for the moral, mental point of view, but also for their carers and relatives. It is very difficult to accept when the person starts to become forgetful, for example. So we have to fight stigma. It should be something that everybody can accept. For example, like with oncology, I just think that maybe we are like 15 years ago with oncology, when nobody wanted to tell that there was something shameful. Now it is okay to say it, and we need to make a society like this. So unfortunately, we do not have official realistic statistics about dementia. So the numbers are 62,000 people with dementia, which are official statistics. But according to the Global Disease Burden Index, in 2019 there were 651,000 people living with dementia in Ukraine. So it means that the official statistics is 10 times lower than it is. And we understand that with the war, these numbers can be lower. It can be 500,000 people. But when we speak about dementia, we're speaking also about their carers who are affected. So what is important is that the problem is not only for the person, but also for the whole family. And according to the researchers, the care about the person with dementia is 3 times harder for a care partner than a care about the person with a physical disability. So unfortunately, the government doesn't see the problem because they do not see the scope of the problem. So we have like 1 million people in Ukraine who are affected, but we do not have any governmental programs to support these people. So we are lucky that we have international partners who support us with this. And we are a young charity that started 2 years ago, and we are trying to follow the international experience. So we are members of international federations that cooperate, that build this for 50 years all over the world. So we are on a very, very beginning level, and we are seeking for partnership and support. So in different fields. So as for the problems, so I think that it is very important for the government and the third sector to work together. And then it can be about awareness, about building the communities, friendly communities, about early diagnosis that I mentioned, that people just do not go on time, but go when it is too late. Then it is just the services that are not existing in Ukraine. Like social services are on the very... So, for example, there is not a single institution, facility for people with dementia in Ukraine. Like memory clinics or some nursing homes or that specialize on this target audience. And it is everywhere in the world. So we have to really build this from scratch. And those services that are provided, they need to be changed because it is very difficult to receive these services. If we speak about social support. If we speak about medical support, it is also very difficult in terms of getting an official diagnosis. In Ukraine, only the psychiatrist psychiatrist can make an official diagnosis, and who would want to go to the psychiatrist? You know, it's like so scary. So it's so there are a lot of, in whatever we really see the sphere, we have to build on the program, you know, to change the situation with dementia. So I'm very happy. Thank you very much for bringing this topic on stage. Thank you.
Thank you. Well, it's hard for people, for our people. I mean, we still have those stereotypes. Not just to go to psychiatrists, but even to go to psychologists. Still for many people. But I know that Valeriia has something positive to add to this statement. Like, the situation has been changing lately, right?
Right.
Please tell us.
But first of all, I want to say that I'm very grateful and happy that today we have such a discussion. And when the National Psychological Association suggested to the organizers to have such a panel, I didn't expect that it would come. And today we can an opportunity to talk about elderly people, and it's really great. And I haven't taken part in such discussion in Ukraine, so let's do something for beginning. About the statistic, the National Psychological Association of Ukraine, we have a hotline for people which operates in Ukraine and in 21 European countries. And when we built a plan for our hotline, we just made an assumption that only 2 or 3% of elderly people will ask for help in Ukraine. Because I think that time I thought that many elderly people have some doubts about psychological help, or maybe stigmatized psychologists, but in fact we have 10 or sometimes more than 10% per month calls from people over 65. Last week we received a call on our hotline from a woman 84 years old. It's our personal record. She was amazing. And I learned from our clients that they need to talk with someone, because the biggest psychological problem of elderly people in Ukraine is loneliness, social deprivation, helplessness, because many of our people, elderly people, they are not aware about different opportunities, how they can help themselves. And of course I agree that we don't have a consistent state program for elderly people. And now we have just few good NGO organizations, today we have them, which help elderly people. And unfortunately, as for me, it seems like a patchwork approach. We have some dots, and we need to make something common and very good organized. So it's a myth that elderly people don't ask for help. They won't ask for help, but unfortunately they don't have an opportunity to ask for psychological help. And to be honest, from my perspective, the biggest problem that the elderly audience is not interested for different donors, and is not interested for state as well, because it's something like investment, and many donors decided do not invest in elderly people because elderly people can't pay back. And I think that helping elderly people in Ukraine is a service, and all we do a very good deal to help our people over 50, over 65, because they really need this help due to social issues which affect their mental health.
I guess this is our payback to those people as a society.
Exactly. It's our gratitude.
And you said, I have a question, you said that all elderly people have no opportunity to ask for help. Why, and what would they need to get that opportunity?
I can tell only about our clients. Many of them are still live in an active war zone, and it's very difficult for them to move from these areas because it's their homes, and all their lives are connected with that places. They have many domestic chores, they have many duties on that places, animals, and they suffer from all the consequences of war, and of course it deprives many opportunities to receive help. And the second one is that we have a lack of different services which provide psychological support to elderly people, and we have a lack of communication about that issue for general population. So that's why it's difficult for them.
Thank you. And I want to ask a question to Brittany. And I guess one of those problems why there is lack of accessibility to that help, that's what has been mentioned. They don't even use smartphones mostly, so it's hard really to reach them. I remember like when my grandma was still alive, she had only regular phone, and she would never have idea, she would never even know there is a number to call someone to talk, but like she had us, we called her, but still, those people might not know. Which problems have you faced in Ukraine from your expertise? Why is it and why is it hard to implement practices which are commonly used in the United States, for example, in Europe? What's the difficulties to implement them in Ukraine?
Yeah, thank you for that question. I, first of all, am honored to be on this panel with all of these incredible women that are doing such tangible things in Ukraine. I think that our philosophy at Northwell Health is we build programs that meet the needs of the people that we're trying to serve. And so a telehealth program that might apply to the population looking for an orthopedic surgeon is going to be different than a telehealth program for our geriatric population, right, or our elderly population. And a big issue that we've seen is the technology issue, right? There's a lot of challenges there. But one of the solutions that you mentioned, it sounds like you guys are working on, is creating hubs where the patient or the elderly person can receive telehealth, but it's not in their own home, it's at a hub. And so you set up places where they can go that are in locations that they go to frequently. A place that we've had a lot of success is you see in different cities, you see a lot of elderly people in parks playing chess, having conversations, sitting on benches. We've had the opportunity to go in and do blood pressure checks. So we just set up a table, we tell people we're offering a blood pressure check, and as we're doing that, we ask survey questions. How are you doing? Do you have enough to eat? There's 5 specific ones, and one of them is, have you felt lonely in the last 10 days? And our volunteers, we use all in-country volunteers to do this, they say that question always kind of makes people pause because they have a little bit of an issue admitting it, but then once they're willing to admit it, it opens up a whole other conversation. And because of that blood pressure check, that leads to a conversation about, yeah, I do feel lonely, and I've really been struggling. The internet, I haven't been able to figure out the internet, or my phone doesn't work anymore, or I haven't been able to connect to the people I usually connect to, and then they can direct those people to hubs, physical places where they can go and receive those resources. They can go and learn about the phone numbers, they can go and sit in front of a computer screen that somebody else is helping them navigate, and they can speak to a physician if the physician isn't physically there. So we try really hard to conduct needs assessments and understand the community that we're trying to serve before we build a program for them. And we try to make sure that all of the programs that we build are flexible enough to meet the needs that we're finding out about, and it's not, oh, this is how we do it, and this is the only way we can offer it. Because if we were relying on smartphones, then we wouldn't be able to serve. I think it's 65% of the elderly population in Ukraine do not use smartphones. And then there's the other issue of, you may have a smartphone, but do you have internet access? And
especially during the war,
I was
just
just gonna say,
blackouts, no
yeah.
internet.
Yeah, you don't have internet access all the time. So are there zones that you can go to that have those resources that they can tap into? And then it's just a matter of going to the places where they are and sharing that those resources exist.
Does any of you have experience of helping people directly in frontline zones, or like really close, where it's really dangerous, but those people can't leave? Could you share some cases? How did you manage to do that? Because what I heard from organizations who do that, it's really hard to provide that help in those zones. And do you have something to comment about it? What can be done to make it better?
Well, we don't have such an experience exactly from our organization, but we have a lot of feedback and such stories from our partners on the ground. And exactly, I wanted to comment about the blood pressure. Like, we've received some requests from Kharkiv Oblast that there are many villages which are officially evacuated, but there are some couple hundreds elderly still staying there. So officials claim that there is nobody there already because evacuation has been done, but actually only elderly are there. And the request was like, there is no doctor on the ground, of course, because everything is evacuated officially, so that there is no medical help at all, and they are requesting if we could provide probably with some, like the request sounded, there are a couple of such villages and we need at least one blood measuring device per village. And it is like a mind-blowing request for me. Like, people are there, they're in such a state, and they are requesting only for one blood measuring device per village. Like, this is the whole description of the situation, I would say.
Well, they need way more.
They need way more, and overall the situation is like staggering. I cannot just describe my emotions about that. And also we received from some other partners information about, this was exactly the project of mobile medical brigades, which are going around Kherson Oblast and Dnipropetrovsk Oblast, and they really meet a lot of lonely elderly there, especially like in, let's say, unpopular part of Kherson Oblast, which is quite dangerous to go to, and they say that the state of people living there is just awful, the same as in Kharkiv Oblast. There is nothing. They don't have the doctor, they don't have any social care there, and there are many people left absolutely alone, and many of them with disabilities, and like the need for help is so big, and
what can be done?
Yeah, what can be done? I suppose that the format of these mobile brigades is really the only one which could be efficient in this moment, and as these partners are coming to us as an organization who specifically helps elderly, my hope is that we can build a project together when they are providing the medical help, and we are trying to provide them with other means of support to help those elderly on the ground, because this is exactly the specifics which is very often not taken into account by donors and by implementing organizations, because like not every kind of help is applicable to elderly people. And exactly the specifics of helping elderly in Ukraine is that it should be direct, so they don't need to go somewhere, because many of them can't go anywhere, because, for example, they are disabled. And that is why I suppose the key of helping in such regions and in such situations are some complex projects of mobile brigade, like the colleague was describing, and some additional organization who takes the part of helping with some means like food packages, hygienic packages, and also providing probably some additional things to help with the mending of the house. Because, for example, in Kherson Oblast, many houses which our partner visited, they have leaking roofs, or they still have a bit of the water in there. And I don't know, the food packages, for example, provided by World Food Program are not packed good, for example, and there's a water in the in home, so you need to make some additional arrangements which include and which take into account the local aspects of where you provide this help, to whom you give this help. And also this is showing a bit the fact that really colleague mentioned about the fact that nobody is really focusing on elderly, because there is not much they can give, and we even faced sometimes such an attitude for corporate donors. We were talking to why to help to elderly, they will die soon. This is like something which describes the whole level or the depth of the problem of helping elderly. And that is why I'm also very happy to be on this discussion, and I hope that it will continue later on to join probably our efforts and really try to work not in a patchwork scheme, but to try to create a big network of organizations who are focused on helping elderly, because the problem is huge and we need to do something about it.
Thank you. Yes, sure. Thank you. I want to add to this topic and to share our experience on working at that regions which are close to the front line. Not so close, but still. We have a home care center in Kharkiv, even 2 home care centers. We have in Kryvyi Rih, we have a home care center in Kamensk, it's a Poltava region, in Odessa. And as you know, these regions are often attacked, they have rocket attacks, but still, it will be strange for me to say that our Ukrainians, our social workers are very brave, because they used to work in such condition, and when after some nights when in Kharkiv the all night is bombing, but still early in the morning they start their work, they visit their beneficiaries, and they are doing their work very thoroughly, very they are really caring about that elderlies. And I think that, as all of us, our colleagues said, that we have to involve our society to resolve these problems. Because when we will talk more, when we will pay attention for visibility for this problem, we will have some resolution how to pay more attention, especially of our state, of our government, to this problem. Because the Ministry of Social Politics is always trying to avoid, trying not to talk on this topic of elderly, especially on the help of home care, of basic care, and the reform of the social reform is still in work. As a doctor, I can say that the medical reform, which started and already is developing fastly in Ukraine, has very good results. And I hope that this will happen in the social policy. Because in the medicine, we have the reforms from state, from National Health Service of Ukraine, for providing activities, for providing medical services, all the organizations, governmental, non-governmental, of different types of private organizations, they receive refunds from the state for the services which are they providing. But in social ministry, we still are waiting for these changes. It will help for our beneficiaries to choose the provider of social services, and for us, because it will help too, because now I'm talking about the home care network which we have. All of our staff, they have a good salaries. That's why they are providing their services in a good qualified level. But when we are talking about state organizations where the staff is working for the minimum, they cannot provide good expertized services for the beneficiaries, because they are not feeling safe, they are not feeling satisfied by themselves. That's why they cannot make somebody happy and to feel safe. That's why the state don't want to buy such services from non-governmental organizations, because our service is not, it's not too expensive, but not too cheap for the state. That's why we have to advocate, we have to pay attention to that problem, that we have to provide a reform in social politics, that the service, the money have to go for beneficiaries, and they will have an opportunity to choose a provider by themselves. I think that will help. I changed the topic from the front line to another problem, but
it
still,
includes people in the front line.
but still, yes. But still, they will because at that cities which are near the front line, there are some organizations who provide such types of help, and when we will have some an opportunity to work with states, with territorial, with local partners, with state partners, there will be a bigger amount of beneficiaries who will receive such types of help. That's why I think it's one of resolution of this problem.
Just quickly add, please. I also agree that everything is so much connected here. For example, last year we started a program for evacuation of people with dementia from the east of the country, together with our partner Médecins Sans Frontières. So we moved around 300 people to the safer territories in Ukraine. How we did it, we started to physically search the nursing homes and psychoneurological internats throughout the country where there are free places. And it was very, very difficult. So the official data told that there are no. So basically the problem was that there was no place to evacuate people from the...
They need to be evacuated to kind of geriatric houses, right? Special places.
Shelters for elderly, or if we speak about people with dementia, so these are a special target audience, so they are in the psychoneurological internats or nursing homes. So they were overpacked. And then what we found out that when we talked to the ministries, that they told, okay, there is, for example, a place that was a gerontology house next to Kiev, which was a little bit damaged, but they told that you can make a reconstruction and place people there. But the problem was that there are no qualified staff enough in the country to work in this place. And this is now in my opinion, one of the biggest problems, that we do not have trained, qualified personnel in social sphere, but also, in my opinion, in medical sphere, because according to the statistics that we have, we do not see these people. So the system doesn't work somehow. So the official diagnosis is not placed. So what we are planning to do for the following years, and that will be probably a heart of our strategic programs, will be the educational program. And we have a very, very big project that we are working on with our Australian and American partners for building a national dementia center in Ukraine. So it will consist, there will be a diagnosis and assessment center, a hospital for 200 people, a therapeutical and training center, telemedicine, and also the main idea is that it will be a training center for the whole Ukraine. So it can be as a blueprint for other organizations, other services, that they can come, learn, but also the care partners, that they can learn how to do it. So this is a very huge and important project. We have an MOU signed with the Institute of Psychiatry, and also, so we are looking for partners who would like to support us with this project. So just sorry for small promos.
Valeriia, can you add, I have specific even question to you about this topic. Elderly people who were displaced, internally displaced, how does it influence on their psychological state? Because it's obvious it's hard for everyone to be displaced, but for elderly people it's way worse. Could you tell more about this? How is it happening? Yes. How can they be helped in such cases?
Of course, and maybe I will contribute about the active war zones also, because the hotline allows to spread in different places, and for us it's not so difficult to help people in active war zones, and our psychologists work with people from Kherson, from Kharkiv, from Donetsk regions. They worked under shelling, during air raid sirens. And the most common requests from people, elderly people in active war zones, it's acute stress, high level of anxiety, PTSD symptoms, depression. But we are very ambitious, and we want to reach out people from temporary occupied territories. And now our team have been working on creating a special platform which allows people to call, to us from temporary occupied regions, because our hotlines allows to have a video call with psychologists if you have a good internet connection and smartphone, for example. If not, you can make an ordinary call using the ordinary phone, and it will be free for you. But the biggest problem is that in temporary occupied territories, the Russians cut the Ukrainian mobile connection off, and people can't call to Ukrainian psychologists for free. So we tried to solve this problem and create a special platform which allowed to do this. About internally displaced people, it depends on the age, because, for example, some of our clients, they experienced the World War II. They were born when the World War II ended or started. So it was very close in their experience. And today, they experience the second war in their life. And it's a very dramatical situation, to be honest. People who leave their homes, of course, feel very depressed because they lost connection with their possessions, their home, their friends. And from my perspective, it's very difficult for people, elderly people, to root in a new area, in new communities, especially in other countries, because many of them have language barrier, and it's really difficult and challenging for them to adjust to new reality, to new services. It's difficult to find new friends, and they are very, very lonely. And sometimes people from other country call to our hotline and ask us to speak with them in Ukrainian because they are deprived from Ukrainian community. For example, many of our people, they don't live in big cities. They live in different villages, and it's a big problem for us. And of course, it affects their moral state and their mental health also. Internally displaced people, it's another challenge because they face different social challenges and issues, and we mentioned all these issues, and they need to start their life from zero. I think that it's difficult in every age, but when you over 65, for example, I think that's a bigger challenge.
Brittany, what have you faced from elderly people in Ukraine? What are the challenges except the lack of smartphones? Their mentality maybe. Is it hard for you to help them?
No, it's not hard for us to help them. I think one of the biggest issues that we've seen is a lot of the services that they were experiencing previously have been affected by the war. So things like rehabilitation. It's very typical when you are older to fall and break your hip, or to need certain rehabilitative services after different injuries and different operations. And because of the overburdening of the medical system right now in Ukraine, these geriatric patients aren't getting those they're not getting those services. So they are being, after hip surgeries, they're being left in beds too long, they're not helped to stand up because there are soldiers in the hospital that are also being assisted. And there's just simply not enough providers, there's not enough care providers for those people in those different locations. And so a big thing that we are trying to impart to our medical partners at the different hospitals that we work in, and again, we work telephonically, so we are not physically in those hospitals. We're providing guidance via telehealth, so Zoom calls with the providers there, with the doctors. And what we've been trying to do is establish what's called task shifting. So a provider in Ukraine is the one that does the rehabilitation with an older person, with an older patient. But what we're saying is you can train 5 people who are not doctors to go in and do those rehabilitation movements with the patients. And so but doctors don't have time to do that. So we are using tools like Zoom and other telehealth platforms to provide those services, to provide those trainings to members of the community, to volunteers, to family members who want to help their loved one rehabilitate. And so we are doing things like, this is how you stand somebody up out of bed who just had hip surgery. This is how you help somebody go to the bathroom. This is how you help them do their exercises of standing up and sitting down. And we're able to train people who are here that aren't physicians, that aren't nurses, because they, are responsible for other things, to be able to do those movements and get these people back on their feet so that they're able to get their quality of life back and continue moving forward in their life. Because I think often, I think we all see this, when it comes to these geriatric patients, the assumption is, well, their life is over. They don't need a quality of life, but they still have gardens to garden, they have grandkids to take care of, they have their chess to play in the park, they still have activities of daily life that you need medical services to help them get back to. So while there are so many challenges, there are opportunities to train other people in the population to assist in these efforts that we're all trying to accomplish.
And correct me if I'm wrong, as far as I understand, like quality of life for elderly people can be much better with a certain help, right? With a certain care, even dementia. You can, like, if you diagnose it on time, you can live with it and not suffer from it that much.
Yeah, exactly, but even if it's not diagnosed in time, at any stage, the person can live with dignity, have have a meaningful life, have senses, what you mentioned. So, and that is about the society really, and about the care that's being provided. So it's about really training and making effort. So it is possible, because I personally saw people with dementia who are running marathons, are sitting on the panels like this, and advocating for the rights of people with dementia.
They're not Ukrainian people.
Not Ukrainian for now, but we'll see.
Like, I mean, I can add, like, anytime my mom goes to doctor, she's not that elderly, she's 63, but, I mean, she's super active, but she doesn't feel well, but she wants to feel well, and she's used to do things she likes to do, and something hurts, and every time doctor said, well, you are aging, what can be done? And she can't accept it, like, you are aging. I mean, I believe there are things which can be done still, it just somehow our government medical system is not really supportive in that for multiple reasons.
She has to
right?
change a doctor.
Sorry?
She has to change a doctor.
Well, she tried different
because
ones.
this doctor don't know what is prevention. He only wants to treat.
Yeah, no,
but
like
still, the
that's
prevention and detention is better for patients and for our beneficiaries, especially elderly ones.
So do we need like something from the government, from municipalities or something? Like what can be done to make the life of elderly people easier and better already?
Yes, of course we need a lot, but the first point is to see those people, to accept that they exist, and the most important, that they are like not useless, like they are accepted. They have actually potential and have something to give to us, because what we are facing now, and which will influence the country a lot, is the demographical state. That now 30% of our population is living like it's beautifully said, the second half of the life. And these people still have a lot of potential, a lot of things they can provide us. Like grandparents are providing the child care, and they can do this, and they can do this even more. Also, there are actually many jobs which could be filled with people who still want and can work. And we really will need it, because we are like losing young people daily due to fighting, and we have lost a lot of people due to the war and the fact that people left the country, and many of them won't come back. And that means that even demographically, now the state needs these people, and it needs to see older people. And we suppose in Starenki that changing the attitude and like giving this link that the country needs these people, and this might be the link like to changing the attitude. But regarding doctors and prevention, like recently we also got some feedbacks, like you said about your mother who is around 60, and this case was about the woman who is 85 and who suddenly felt a bit like less energy and vertigo and so on, and my friend brought her to the doctor, and doctor said, what do you want me to do? You are dying slowly, so... And I'm like, okay, this is an attitude, real attitude. And I wanted to add a bit about the social care service. Like from my recent talks to the ministry and the deputy ministry, she said that they are really committed to changing the monopoly on the social care services, and this is really what should be done, because we work closely with state social care, and many, like it was lacking people before the war, and then after the war started, many of specialists left, and that means that there are really not enough specialists there, and the salaries are so low that sometimes we face the situation that we are helping some older person whose pension actually is equal to the salary of the person who is providing help. And I'm like, okay, and also this person who is providing help, social care worker, is of the age like 60s. Yeah, and I'm like, okay, but why then are we providing help to this elderly person and not to the social care worker? So the situation is quite weird, and I suppose that like demonopolization of the social care services is really the key, because like state is not able to provide the service which is needed, and it shouldn't, because really after studying numerous international documents and programmatic documents of UN and other organizations who have paid their attention to elderly at some moment, we found a lot of places which are stating that the civil society, the third sector, is the one who meant to help with the problem. And we are, the organizations who are helping elderly should be one of the drivers of everything which is happening there, of fighting social isolation, of fighting the ageism, of, I don't know, in our case, of helping the state to reform the sector, and of fighting the attitude from doctors and so on. And we are really thinking that like you can do it mainly and successfully and sustainably only working from the positive side. So we as an organization are aiming to go into advocacy and to probably to work with people of younger age, to bring attention to the problem and to say that the questions of age are not so scary. You can look at them, you can look at the topic, you can prepare yourself to your older ages, you can talk to your parents who are, I don't know, 50 years old, and they are saying, oh, we are so old, we won't start learning something new. Like, this is a very slow path, but only this will help in the long term. So even the fact that we are now talking about this topic is exactly a step towards some changes, and this is very important to think about it, to talk about it, and to do at least little steps about it. And of course our dream is that we will have more and more organizations, non-profit organizations or some volunteering associations who will help elderly, and that the topic will be visible, because this is the key.
Yeah, if I could add to that, I want to start off by saying the United States is also not good at taking care of our elderly population. We really struggle to address similar concerns of loneliness, of both overutilization of healthcare services and underutilization, and we are not great at prevention either. A lot of our citizens don't go to the doctor enough when they're younger, and that leads to higher acuity levels of illness when they're older. And so if I could just, a couple lessons learned, things that we should have done differently after major wars in the United States, such as the Vietnam War, is one, we should have recognized that there is an aging population who are going to need services, and it took us way too long to create a quality system around taking care of people that are 65 and older for the exact reasons that we're talking about, because physicians say, oh, well, you're just getting older, and they blame it on age. They don't blame it on high blood pressure. They don't blame it on lack of medication or lack of nutrition. And so we have just started looking at, well, what is the appropriate blood pressure for somebody 65 and older? What should their blood pressure be? How many of our patients that are 65 and older go to the hospital, leave the hospital, and then come back 30 days later? We're now starting to look at these quality metrics, and we're studying them, and we're trying to find out where did we go wrong? What did we not treat that we should have treated? And to make a business case for it, you end up spending way more money on elderly patients who you have not taken care of for a long time at the end of their life than if you do the little things that you should be doing sporadically throughout their lifetimes to take care of them in a preventative way. And so you can argue to the state, which is what the healthcare industry had to do in the United States. We had to say, we are spending more money on 75-year-olds than the other 90% of the healthcare population. And if we can figure out how to treat the 75-year-olds better when they're 65, we'll spend less money. And so, unfortunately, you have to make it a business case argument for the way you approach taking care of elderly people. And then you have to say, and how are we going to hold ourselves accountable? What quality metrics do we need to establish in all of our hospitals that everyone should be following? And the state passes legislation that makes those the quality metrics that everybody should be watching out for. And if people do not meet those metrics, they don't receive state funding. And that's something that the US took way too long to figure out, and we are suffering from it, and our elderly population is suffering from it. And it's something that now in Ukraine, as you're going to be in this stage of rebuilding, because of everything that's happened and because of the foundation that you're laying right now of having these conversations of the NGO money that's pouring in. The European Union is going to be so interested in investing in Ukraine. Having those conversations now is going to lay the foundation to rebuild a healthcare system that actually cares about its geriatric population and builds metrics and holds itself accountable for how you're taking care of them. But if you're not paying attention to the actual medical, clinical outcomes of treating these patients, then doctors can say, you're just getting older, go home.